And I was saying that this bacteria belongs to the family Pasteurella, and it's related to two other genera. No? We have the genus Actinobacillus and Haemophilus, which we have discussed in the past week. So this week we'll study genus Pasteurella. So like I mentioned, this is a gram-negative bacteria. Here we see the gram stain, and it appears to be stained with safranin. And if you look at the morphology of this bacteria, it is a cocobacillary form. So you see the short cocobacillary appearance of this bacteria here. And the in this particular slide, the species here that's being shown is your Multocida. So Multocida, Pasteurella multocida, is the most important species. However, there are also other species that we will mention later. So this particular bacteria is considered as non-motile, and it is a facultative anaerobe. These are the biochemical characteristics now. So it's oxidase positive, nitrate reductase positive, carbohydrate fermentative, and it's considered as a commensal parasite of animals. So this means that it's present as a normal bacteria in the respiratory tract of your hosts, no, of the animals. Here we also see the morphology of the colonies. So these are circular in form, and they also have an ombonate elevation. So here we can see the ombonate appearance of the colonies. And this is Pasteurella multocida on blood agar. Okay. And some of the characteristics regarding the composition. So this bacteria, they possess capsules which contains acidic polysaccharides. And the capsule of the Pasteurella is an important virulence factor, as we'll illustrate it later. This bacteria needs this capsule in order to um, cause disease. You have type A, Pasteurella multocida type A, which contains hyaluronic acid. And it, as a gram-negative bacteria, it also contains the lipopolysaccharides. So you already know that, diba? In the past few lectures, we mentioned LPS, or lipopolysaccharides. And this is an antigen that is associated with your gram-negative bacteria. Here we see the capsule and its importance in the pathogenicity of Pasteurella multocida. So the capsule, it allows the bacteria to survive and resist the host defense mechanisms of the host. We have an illustration here of the capsule of this bacteria. On the left image, this black arrow is pointing to the capsule of this bacteria. And in an experiment in this study, they studied two strains of this bacteria. One which has a capsule, which is on the left side, and then on the right side we have a strain of Pasteurella multocida, which does not have a capsule, or has very little capsule surrounding the cell. And they found out that in mice, when you inoculate this bacteria, this strain A on the left will cause 100% mortality at high and low doses. So even though you administer a low level of infection to the host, it will still cause 100% mortality. And then you have strain B here, which is devoid of the capsule. So at low doses, this bacteria will cause 0% mortality. So this shows us that the capsule is important for the pathogenicity of this bacterium. Okay, so next we go to the LPS. So the LPS, this particular component of the bacteria binds to the macrophages, and it is directly toxic to the respiratory endothelial cells. So I mentioned earlier that this is a commensal of the respiratory tract, and once they are reproducing or multiplying at high levels, they can cause disease. And LPS, this can allow this bacteria to bind to macrophages. So the macrophages are one of the main defense mechanisms in the lungs, and then it can cause damage as well. So normal endothelial cells of the respiratory tract, it's directly toxic. And then you also have the outer membrane proteins. They are iron regulated. And then these are considered as toxic as well. And then we have the adhesins. So we are familiar with adhesins. It allows the bacteria to attach to the cells. And then you also have the toxins, which will also act as a defense mechanism to the leukocytes. And then you have enzymes involved in disease production. And this is the hyaluronidase and the neuraminidase. So Pasteurella is not the only bacteria that produces this, but these enzymes, no, they are also produced by other organisms. Even viruses can produce this, such as your influenza virus. No? So these enzymes, if you look at the suffix "ase", diba? This tells us that these are enzymes, and these are components of the connective tissue. So once this bacteria is able to lyse these connective tissues, it allows this bacteria to further invade the lungs. For the leukotoxin, this this particular toxin at high concentrations is considered as cytotoxic to the leukocytes. So the leukocytes are the part of the blood, which is the white blood cells. No? And those are mainly neutrophils. They could also be lymphocytes and other leukocytes. And in cases of bacterial infection, these leukocytes, they will increase in number. And you will be able to see that in a complete blood count. And this leukotoxin is a defense mechanism for this bacteria. No? At low concentrations, it will activate the leukocytes, and it will downregulate a major histocompatibility complex class 2. And this is simply a signaling mechanism for this bacteria, for the host, to recognize antigens. So at low levels, it will not be toxic. However, um, this will signal the host that there is some foreign agent that is present, and this will trigger an inflammatory response. No? So apart from the leukotoxin, you also have the PMT, or the Pasteurella toxin. And this PMT, it has several names, no? So this is considered a dermonecrotic toxin, an osteolytic toxin, and it's associated with a disease called atrophic rhinitis, wherein the turbinates will appear as um, they will appear atrophy. We have a picture of this later, so we can see what is atrophic rhinitis. But basically, this bacteria, it has the ability to control the cellular actin cytoskeleton of the cells, and it will also cause lysis of the cells. So it's osteolytic, so it will lyse the bone cells. No? And uh, I mentioned that they are part of the respiratory um, uh, environment, no? And so they can be found in the mucous membranes of susceptible hosts. They can affect a wide range of hosts. They can be seen in birds. So we have fowl cholera, and even in cattle, no, in large ruminants, they will cause a disease called hemorrhagic septicemia. And transmission is widespread. So infection may occur through inhalation, ingestion, direct contact with open wounds, bites, and scratches. And they can also cause endogenous infection. So I think we've mentioned endogenous infection in a previous lecture, but just a review, yung endogenous infection, it usually occurs when a bacteria is already present in the host, so, as a commensal possibly or an opportunist. And then during a stressful event, for example, a viral infection, this bacteria will cause a secondary bacterial infection. So a lot of the bacteria are like this, and you will notice that in your other when you study the pathogenesis of other microorganisms. So for the pathogenesis, severity of lesions depends on the site of infection and the virulence of strains and resistance of the host. So there can be some more virulent strains than others. And vascular damage results in hemorrhage and fluid loss. Focal necrosis in parenchymatous organs and ulcerations on mucous membranes may occur. And during pneumonia, inflammatory cells infiltrate the lung parenchyma with erythrocytes, neutrophils, and mononuclear cells. So a lot of the time, the severe pathology that we see in this type of bacterial infection is mostly caused by the host response, no, the inflammatory response. Kaya nakikita natin parang worse yung symptoms, no. And the lung tissues will appear black to red, pink, and gray, and there can be necrosis, abscess formation, fibrin deposits in severe cases. So ganun naman kapag bacterial infection. And there is caseopurulent inflammation, which can occur in the joints, middle ear, ovaries, wattles of birds with chronic fowl cholera. And in swine, this is particularly in swine, there is disturbed osteogenesis, which causes distortions of the turbinates and bones of the snout. So here's a summary of the disease in each affected animal and what is the most important species to take note of and the symptoms. So for cattle, we mentioned that this bacteria has a wide host range. No? So pwede siya sa large animal, uh, small animal, and then you have avian as well. So for cattle, the specific disease is hemorrhagic septicemia and shipping fever. There are two notable species, the Pasteurella miltocida and hemolytica. And this is characterized by high fever, diarrhea, edema, sudden death, inappetence, and respiratory signs. So yung hemorrhagic septicemia, this is important in cattle production, in dairy production, kasi present siya no, in worldwide and even in the Philippines, this is present. Yung tawag sa kanya, hemosep. And this is also important in yung mga Philippine carabaos natin, yung mga kalabaw natin. No? So there was a time where there was a uh, outbreak of hemosep here in the Philippines. Kaya parating nagpapakuna against hemosep. This is a requirement. No? And then yung shipping fever, this is seen in animals that are being transported. So, for example, if the animal has to travel for uh, for importation or if it needs to be transferred, they may undergo this um, this course of the disease where they will experience high levels of stress and the bacteria will proliferate no, and cause disease. Sa small ruminants, there is septicemic pasteurellosis and enzootic pneumonia. So two species are important, the Trehalose and Hemolytica. And they can also cause gangrenous mastitis. Now we'll look at some pictures later of this mastitis. No? Pero just take note, there's also enzootic pneumonia in swine, pero it is caused by a different bacteria, which is your Mycoplasma. No? So this one is different. This is enzootic pneumonia in small ruminant, and it is caused by your Pasteurella. And then you have in swine, you have fibrinous pneumonia, atrophic rhinitis, and this is caused by your Pasteurella multocida. The symptoms are sneezing, epistaxis, staining of the face, tear duct obstruction, and lateral deviation of the snout. And this is caused by the osteolytic toxin that we talked about earlier. So yung lateral deviation of the snout, the bone tissue that's associated with the snout, they become lysed. So, hindi na siya symmetrical, no, yung appearance niya. And this is often following viral infections, lalo na itong fibrinous pneumonia. I also wanted to add na hindi naka-include dito, this Pasteurella multocida is also important in a complex called your porcine respiratory disease complex or PRDC. So yung porcine respiratory disease complex, it is often associated with or initiated by a viral infection. For example, your PRRS, your PCV2, which you will encounter again in your virology. So that's porcine respiratory and reproductive syndrome at saka yung porcine circovirus infection or PCV. So these two viral agents are often associated with P. multocida infection and they will cause PRDC and the appearance is usually this one, fibrinous pneumonia. In rabbits, there is a disease called Snuffles, and this is caused by your P. multocida. So the symptoms are bronchopneumonia, middle and inner ear infection, conjunctivitis, and septicemia. In birds, so we have chickens. No, chickens can usually be affected by this. I still see this, or this can still be seen in uh, your native chickens, and even yung mga panabong, no? Uh, Sila kadalasan yung makakakita ka ng fowl cholera. And there is a vaccine that is uh, uh, that can be given for this fowl cholera. And the species is Plymouthosida. So this can cause per acute anorexia, diarrhea, nasal and ocular discharge, subacute rales, mucopurulent discharge, and chronic caseous lesions, which are localized. In dogs and cats, Pasteurella can also cause wound infections, no? And it appears as purulent exudates. In horses, it will cause equine respiratory disease. There is a specific species that's associated, which is Cavalli, but it is often together with another bacteria, which is your Streptococcus zooepidemicus. And then in small lab ruminants, small lab rodents, you have Pneumotropica. That's the species associated, and it's considered as a commensal, but it can cause pneumonia. And then in humans, you have wound infections from animals. Now, this is caused also by your Motocida. So let's look at some pathology that is associated with this bacteria. So this is a chronic bacterial pneumonia caused by your Pasteurella multocida. So here we see the entire one side of the lung, no? And you can also notice that the lesions, no? You can see this in the ventral part of the lungs, no? This bacteria is a facultative anaerobe, so it can survive both in areas where there is oxygen and without oxygen or low levels of oxygen. So sometimes you will notice yung mga aerobes, no, they will only affect the cranial part of the lung kasi mas mataas yung oxygen level dun, or they will only infect the upper respiratory tract. But when you think about it, yung mga facultative anaerobe, they are able to penetrate into the deeper parts of the lung. That's why you see this lesion, no? And here we see some necrotic areas, hemorrhagic na siya, no? And this is also consolidated. So, di ba, necrops, ay nakapag-open up na kayo ng animal, no? And ano yung normal na feel? Ano ba yung normal na feel ng lungs? Can you describe kung ano yung pag hinawakan mo yung lungs, how would you describe it? Okay, that's right. So there, I have one answer, spongy or airy. That's correct, no? So, yung jelly-like. So usually you would consider it as or describe it as spongy. And if you press it, no, there should be some air within the lungs, no. So para siyang bubble wrap, parang ganun. But in cases of pneumonia, these will feel more consolidated, so solid na siya, no? So pagka prines mo siya, hindi siya spongy yung feel, no, no lungs, no. And that's an indication that there is pneumonia kapag consolidated or solidified, nag-solidify na siya. Yun yung ibig sabihin nun. This is an example of the atrophic rhinitis. So we have a cross-section of the turbinates. Here we see some semblance of normal appearance of the turbinates, but on the left side, we can see that this snout of this animal, meron ng lysis of the turbinates, no? And we can see this better if we look at this animal, there is a lateral deviation of the snout. So this is your atrophic rhinitis in your swine. And you will notice this particular infection. It is in the upper respiratory tract. So yun yung sinasabi ko kanina na example, no? So because it's a facultative anaerobe, it can infect the upper respiratory tract and the deeper portions of the lungs. So, and this one is Pasteurella mastitis. So these are the mammary glands of your sheep. And here we can see some ulcerations on the surface on the skin. And then this part is inflamed, it's enlarged, and it may have some fluids, and some exudation. So this is Pasteurella mastitis or gangrenous mastitis. I mentioned earlier that in fowl cholera, there is a vaccine. So these are considered as bacterians, and it can be provided or given. So that's for fowl cholera. But there is also for hemorrhagic septicemia. So pwede nyo na lang i-take note. Both for fowl cholera and hemorrhagic septicemia, there are some bacterians available. And they can be protective for short periods of time. In the case of hemosep, it's 2 years, no? And attenuated vaccines are most promising against fowl cholera, and inconsistent benefits from most shipping fever vaccines. Yeah. So for shipping fever, since this is a multifactorial disease, meaning that there are many organisms that cause the disease, and it is triggered by stress, medyo inconsistent yung benefit ng vaccine. And we also have bacterians with toxoids against Pneumotocida and Bordetella bronchiceptica, which are effective against atrophic rhinitis. Oh, I failed to mention that Pasteurella multocida does not act alone when it comes to atrophic rhinitis. It is usually in conjunction with another organism called your Bordetella bronchiceptica. So you may have heard that if I was the one who discussed Bordetella with you, atrophic rhinitis is also mentioned there. For laboratory diagnosis, it is relatively easy to isolate this bacteria. So you can use the exudates, tissue impressions, sediments of transtracheal aspirates, and even blood smears can be used. So here we see the blood cells, red blood cells. This is in bovine, and the bacteria goes into the blood, no, it will cause sepsis or septicemia. So the bacteria is present in the blood. And if you perform a blood smear, you can see the bacteria that is present. You'll also notice that siguro sanayin nyo na yung mata nyo, when it comes to looking at blood smears, kasi you will notice that the bacteria very small in comparison to the cells, to the red blood cells. Usually nakikita nyo lang siya sa smear and you need the high magnification in order to see the morphology and relative size. No, I want you to practice seeing or looking at the relative size of the bacteria in comparison to the cells. And then this one is in sheep. So this is the blood agar, and the species isolated here is your pneumotropica. There is moderate resistance to aminoglycosides, and most are susceptible to almost all antimicrobials. But for food animals, so we mentioned that, for example, in the case of shipping fever or hemosept, there must be a withdrawal period for food animals because you don't want the antibiotics to remain in the meat, no? So kailangan bago i-slaughter yung animals, kailangan merong period wherein we allow the animal to metabolize and eliminate the antibiotic from its system before it can be used for human consumption. No? So yun yung ibig sabihin ng withdrawal period. There are, this is a list of your antibiotics that are often used. So you have some tetracyclines, sulfonamides, flurfenicol. These are strong antibiotics na rin. And in practice, mass medication is done. It can be placed in feed and water as prophylaxis or therapeutically. So, ibig sabihin ng prophylaxis, you're trying to prevent the infection. So, you are providing medication before there is disease. And then therapeutic, ibig sabihin, you are treating the animal. So, there is already infection. Pero more recent, with the emergence of your antimicrobial resistance, no, yung prophylactic medication hindi masyadong recommend na because there is development of antimicrobial resistance. And you have to confirm the appropriateness of the antimicrobial using a susceptibility test. So we performed the AST and class, so you're familiar. And then immunization is effective for hemosept and AR. And this is an example of the AST for P. multocida. So they are susceptible to penicillin, but you need to use AST to confirm that. So this is the summary. We have facultative anaerobe, which is a commensal. It's the respiratory tract. Capsule and other toxins are needed to cause disease. And then you have and respiratory and systemic disease is seen in the domestic animals. So they may be triggered by stress and co-infection. So far that is, so that's the last slide for your Pasteurella. Are there any questions for Pasteurella? I'm gonna take a 1-minute break, and then we'll discuss Ornithobacterium.
I I talked to him now. Say bye bye.
Okay, so we will discuss Ornithobacterium kasi this week medyo marami tayong topics that we need to go through. For Ornithobacterium, I only have a couple of slides, so we can go through this uh, quickly. So for Ornithobacterium, there is only one species that is important, which is your Rhinotracheale. This is the appearance of your Rhinotracheale. So they are considered as pleomorphic, So you'll notice there are some short rods, elongated, and then it's gram negative. So this is a relatively recent discovery. So it was in 1991. So were you guys alive in 1991? Kasi when 1991, I was grade 1. Grade 1 na ako noong 1991. So to me, it feels recent, no? And this is a Pasteurella-like bacterium. It's slow growing and yun nga, no? Pleomorphic and gram-negative. There are 443 strains under this species, and there are 7 recognized serotypes. This causes a respiratory infection, in specifically air sacculitis and pneumonia, and it can be a primary or secondary etiological agent. So this causes economic loss in the poultry industry. There is growth retardation, so mababa yung feed conversion ratio, and the carcasses are unacceptable for human consumption. So, like I mentioned, 1991 lang siya na-discover. And this is in broiler chickens in South Africa by Jan Dupreez. There are relatively mild respiratory symptoms. It starts with sneezing at an age of about 28 days and lasts to the end of the fattening period. There is increased mortality, 3% or more, and poor performance considering the growth per day and feed conversion. So there is foamish white yogurt-like exudates that are present in the air sacs, predominantly in the abdominal air sac, and there is pneumonia. So the most important clinical sign is decreased feed and water intake. So even though naka-state yun dito, no, you should take note in poultry. One of the first clinical signs that you will notice with any disease, for example, viral or bacterial infection, is that there will be decreased feed and water consumption. There will be also growth retardation, weakness, dyspnea, mucus discharge, and eventually mortality. There are different strains, and they are equally able to infect different avian species. So yun yung major symptoms na nakikita. It's respiratory, but the abdominal air sacs are mostly affected. So here we see the abdomen, we see the intestines, and we see these foamy exudates as well as the large clots of fibrin that are present in the abdomen. So this is associated with your Ornithobacterium rhinotracheale. And here we also see the lungs of the birds, and this is a pneumonia. So on this side, we can see some lesions. We have dark red areas, which indicate that they are there is pneumonia, there's damage to the lungs. And this is showing, the next few slides are showing the pathogenesis of your Ornithobacterium rhinotracheale. So first, you will notice they will adhere to the surface. This is the cilia of the uh, respiratory tract. So initially, they will attach to the epithelial cells, and then you will see them eventually invade. So this is 2 days post-infection. This is the respiratory epithelium. Um, and then eventually they will go into they will be able to infiltrate, the air sacs. And you will also see some inflammation. So the host will recognize the presence of the bacteria, and then it will send out some macrophages and other white blood cells. So these are the macrophages here. And then here are the brown spots, these are the bacteria as detected by immunohistochemistry or IHC. And you will see that these bacteria have now penetrated the air sacs. Eventually, they will cause damage. So here we see the necrotic parts of the air sacs now. And the brown spots are the bacteria. And further, they can go into the vault or the bronchi associated lymphoid tissue. And the bacteria will invade, and you can see them here with the brown spots. Those are positive areas of the lungs, which this bacteria has infiltrated. For the treatment and control, the oral antibiotics will perform poorly, but if you use tetracyclines and penicillins, which are injectable, you may be able to control the disease. Some strains are slightly sensitive to enrofloxacin and PMPS, but some are considered resistant. They may be sensitive to the ones that are recommended for injection. So yung tetracycline, P, and amoxicillin. Okay, so I think that is the last slide for treatment and control for ornithobacterium. Okay.